I'm Dr. Madhusudan. I'm the veterinary consultant and medical director of LOTUS EYE Hospital, Coimbatore. I have a message for all diabetics. Nowadays, we are seeing a lot of diabetic patients are coming to us with end-stage diabetic eye disease. The message is this: if you have sugar and you're a diabetic, it affects almost all the organs in the body. It affects the kidneys, it affects the foot, it affects the nerves, and especially it affects the eyes. If you're a diabetic for about 5 to 7 years, then you will only have an early diabetic retinopathy or maculopathy, and your vision is only slightly compromised. All you require to get it done is walk into any eye hospital and get your eyes dilated, and the doctor will examine your fundus. And if you have any maculopathy, it is very easy to treat. We do a very simple investigation like a fundus fluorescein angiogram or optical coherence tomography, which will reveal how much is the macular edema. The treatment is one, either a simple injection in the eye or a simple laser. That is all it takes to prevent further progression of visual loss. Even if you have forgotten at this 5 to 7 years to get your eye checked, and most of the patients come to us at a much later stage, like 8 or 9 years or even 10 years. During that time, the diabetic retinopathy has progressed from a non-proliferative diabetic retinopathy to the next stage, that is a proliferative diabetic retinopathy. அப்படின்னா என்ன அர்த்தம்னா, you now start having some new blood vessels in the eye. These new blood vessels is formed as a result of decreased blood supply because of high sugar. So this is likely to cause bleeding. கண்ணில் வந்துட்டு ரத்த கசி வந்துடும். இது வந்துட்டு திடீர்னு பார்வை கம்மியாயிடும். உங்களுக்கு வந்துட்டு கருப்பு பூச்சி பறக்கிற மாதிரி இருக்கும் கண்ணில். இது வந்துட்டு this indicates that you have some problem. You have to come to the eye specialist. Now when we do a simple examine your eyes, we find that you are having some bleeding. சில ஏரியாஸில் வந்துட்டு tractional retinal detachment, கொஞ்சம் ஏரியாவில் விழித்திரெல்லாம் கொஞ்சம் தூக்கின்னு இருக்கும், and new blood vessels இருக்கும். Even in the ஸ்டேஜில் கூட வந்துட்டு உங்களுக்கு ட்ரீட்மெண்ட் வந்துட்டு it is good. We do a simple B scan. Sometimes you do require a simple surgery. Sometimes we can manage you with injections. We call it an anti-VEGF injections, and these injections will cause reduction in the vitreous hemorrhage. And in the injection போட்டுட்டு ஒரு 2 or 3 weeks கொஞ்சம் வெயிட் பண்ணால் உங்களுக்கு அந்த ப்ளீடிங் எல்லாம் தானாகவே கம்மியாயிடும். அதுக்கப்புறம் வேணால் we can do some laser treatment. Some patients வந்துட்டு ரொம்ப லேட்டாக வந்தாங்கன்னா அவங்களுக்கெல்லாம் வந்துட்டு you have extensive retinal detachment, அது tractional retinal detachment in பேர். அந்த மாதிரி இருந்ததுன்னா they would definitely require a surgery called vitrectomy. இந்த சர்ஜரியில் நம்ம என்ன பண்ணுவோம்னா, it is just like a very very small incisions we place, and we remove all the traction in the eye, and we also remove all the bleeding in the eye. The vitreous hemorrhage is cleared, the tractions are removed, and then the retina வந்துட்டு திருப்பி அது ஒட்டி வச்சிடுவோம். இந்த மாதிரி சர்ஜரிஸ் எல்லாம் நார்மலி it takes about 45 minutes to 1 hour. And sometimes we put some tamponade agent like a silicone oil in the eye. In the effect of the silicone oil என்னன்னா, it will make sure that there is something which is putting some pressure on the retina to make it stay attached. அப்போ நீங்கள் வந்துட்டு we'll ask you to maintain குப்புறப்படுக்கிறது prone position for at least about 2 weeks. With this, majority of the people are able to regain vision. But we don't want you to come at this late stage. Okay, so my message to all diabetics are, you are taking care of your blood sugar, you're taking care of your BP, okay, but you're completely forgetting about the eye. So all diabetics வந்துட்டு at least once a year வந்துட்டு you have to get your eye checked. That means they put a drop and check the back of the eye. Okay, this goes a long way in preventing diabetic retinopathy, because diabetic retinopathy causes blindness. So you have to help us in eradicating diabetic blindness by coming forward to get your eye checked. If you have any relatives of yours, your parents or brothers or sisters or who are diabetics, encourage them to go to the nearest eye hospital and get it checked. If you're an insulin dependent diabetic or you're a long time diabetic for more than 15 years or so, then at least once in 6 months you have to get your eye checked. This is my message to you. Stay home, stay safe, and get your eye checked. Thank you.